Welcome back to our final day of Construction Safety Week. For our final topic, Emergency Preparedness and Response, Roadbridge is highlighting the signs, symptoms, and chain of survival for heart attacks, cardiac arrest, and stroke. These can occur at any time to anyone, young or old. Know the signs and symptoms of a heart attack. Pressure, fullness, squeezing or pain in the center of the chest or chest discomfort, feeling lightheaded or dizzy, sweating, shortness of breath, pain that spreads to the shoulders, neck, or arms, feeling nauseous or vomiting, and having an overwhelming sense of anxiety, much like a panic attack. If you suspect you or a coworker are having a heart attack, know the chain of survival. Recognize the warning signs. Immediately call 999 or 112. Administer CPR. Know and use the closest AED. Advanced care needs to happen within 5 to 8 minutes.
How do you know that someone is having a heart attack? The most common symptom is chest pain caused by the oxygen-deprived heart muscle. Patients describe it as crushing or vice-like. It can radiate to the left arm, jaw, back, or abdomen. But it's not always as sudden and dramatic as it is in the movies. Some people experience nausea or shortness of breath. Symptoms may be less prominent in women and the elderly. For them, weakness and tiredness may be the main signal. And surprisingly, in many people, especially those with diabetes, which affects the nerves that carry pain, a heart attack may be silent. If you think that someone might be having a heart attack, the most important thing is to respond quickly. If you have access to emergency medical services, call them. They're the fastest way to get to a hospital.
Know the signs and symptoms of cardiac arrest. Sudden collapse, unresponsiveness, abnormal breathing, such as gasping or no breathing at all. In the event of cardiac arrest, know the chain of survival. Immediately call 999 or 112. Know and use the closest AED. If two people are available to help, one should begin CPR immediately while the other calls 999 or 112 and gets the closest AED. Know the signs and symptoms of a stroke. Sudden weakness or numbness of the face, arm, or leg, especially on one side of the body. Sudden confusion, trouble speaking or understanding. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness, loss of balance or coordination. Sudden severe headaches with no known cause. Learn to recognize a stroke and remember to think fast. Face drooping. Is the person's smile uneven? Arm weakness. Can the person raise both arms and keep them up? Speech difficulty. Does the person's speech sound slurred or unclear? And time to call 999 or 112. If a person shows any of these signs, get help immediately. They need to get to a hospital.
The symptoms of a stroke can be wide-ranging, depending on which parts of the brain are affected. If the stroke occurs here, it would cause a drooping face. Here, weakness in the arms or legs. Or here, difficulty speaking. Other symptoms can happen too, like changes to vision, loss of balance, confusion, and memory loss. The effects might be barely noticeable, but are more often severe and disabling. Sometimes these changes can be reversed if treatment is started early. That's why it is so important to act quickly if you suspect a stroke. Remember, you need to get help fast. F is for face. Is their face drooping on one side? Can they smile? A is for arms. Is there weakness in the arms? Can they lift them both up? S is for speech. Is their speech slurred? T is for time. If you spot any one of these signs, then it's time to call an ambulance.
While heart attack, cardiac arrest, and stroke can happen at any time at any site, it is also important to remember the emergency responses for site-specific situations such as marine rescue, trench collapse, and falls from height, just to name a few, and these are covered on a site-by-site basis. Thanks to the Roadbridge site teams at Greenock and Bat3 for their videos and photos showing their emergency response drills and preparedness. As we wrap up this year's Construction Safety Week, we'd like to thank again everyone who has contributed to our presentations, especially Bill Hill and those at the Lighthouse Charity, Joe Callahan and the team at Hoistech, and all of our Roadbridge site teams who helped put together and develop videos and photos for our Safety Week. We look forward to another year of working safely and continuing along our safe path journey. Roadbridge: People, Engineering, Infrastructure.